So I just want to introduce myself. I'm Erin Matthews Thomas. I'm the Senior Program Officer here at Potomac Health Foundation, and I'm joined by my colleague, Kukwa Osei-Gyamfi, who's our Program Assistant. Susie Lee is our Executive Director. She will not be able to join us today, but she definitely sends her warm regards. Next slide. So for today's webinar, we will be focusing on the foundation background, obviously the application and the request for applications, process and procedure, next steps, and questions and answers. So I wanted to start off with these next two slides are really important. As I stated a bit ago, we do have a large number of organizations who signed up for the webinar. So today, these next two slides are really going to hit on just two key points that I want to address before we started really moving forward into the presentation. And the first being that today's webinar is focused exclusively on the new requests for applications. So those organizations that currently have a large grant with us will be considered for continuation funding in a separate process. So again, this is for new projects. Next slide. And the other very important piece is respect to our service area. So applications will be accepted from tax-exempt organizations that serve the people of Eastern Prince William County and the immediate adjacent communities in Southeastern Fairfax, which is Lorton, and North Stafford counties. So organizations may be headquartered in other parts of the Commonwealth or region. For those agencies, you must be able to clearly delineate how the Potomac Health Foundation catchment area will benefit from the work of the grant. So for example, your organization can be housed in Richmond, Virginia, or Washington, D.C., or Montgomery County, Maryland. That's fine. However, the work and service has to be within our service area, which is once again, Eastern Prince William County, Southeast area of Fairfax, and North Stafford counties. Now I'm going to turn it over to Kukwa, who is going to talk about the background of the Potomac Health Foundation.
Hello, everyone. So the foundation was established in December of 2009, and it has a legacy in what was known as the Potomac Hospital. The Potomac Hospital was found in the 1960s in Prince William County and was one of the largest and fastest growing, counties in the United States. At that time, it did not have a local hospital. So in 1972, Potomac Hospital was established, and it was the last hospital in Virginia that started from a grassroots effort. One of our current board members was the president and CEO of the Potomac Hospital for 34 years. And I don't know if any of you guys know him, but his name is Bill Moss, and he's awesome. So when Centera inquired to buy Potomac Hospital in December 2009, the hospital and Centera merged, and that became the Potomac Health Foundation. So the Potomac Health Foundation is an independent private foundation with about 12 members of the board of directors who are longstanding members of the community and are invested strongly in our community. And so the whole purpose of the Health Foundation is to continue the legacy of caring for perpetuity, especially for people in Prince William catchment area. So the mission of the Potomac Health Foundation is to improve the health of the community by increasing access to healthcare for the medically underserved. And so our value statement, which we came up with last year, is that we value equitable access to healthcare. As such, we are a catalyst for ideas to improve access to healthcare for the medically underserved. Our work is informed by the lived experiences of our community members. And I'm going to give it back to Erin.
Thank you, Kukwa. So this slide in respect to our strategic plan, the Potomac Health Foundation strategic plan is really the driving force behind our grant making process. Access to healthcare, mental health, and capacity building. Moving into 2021, we thought it was important to continue with this plan for our grant making, convening, and technical assistance for the 2020-2022 grant cycle. I'll turn it back over to Kukwa.
So this year, Potomac Health Foundation seeks the following types of projects: access to healthcare, behavioral health, capacity building, and COVID-19 response and assistance. So Potomac Health Foundation's commitment to the request for applications. Funding is project-based and should be considered as one-time only. Our grant year will run from July 1st, 2021 to June 30th, 2022. I'm going to give it back to Erin.
Thank you, Kukwa. I had just to also say, please use the chat to ask questions. We'll definitely address them at the end of the presentation. I did see someone ask in respect to the continuation applications and when there'll be information about that. As you know, for those who currently have a grant with us, the interim reports are due next week. And after that point, we'll be able to review those applications and make a determination about potential funding. So that should be coming within a month's time. All right, jumping back into the presentation. Under access to health, Potomac Health Foundation seeks projects that focus on improving access to healthcare, social determinants of health, and serving the medically underserved residents in the age of COVID-19. So as far as access to health, and then we'll start here and then move on to the other focus areas. As we go through the next few slides, recall that this presentation is as including but not limited to, and this is not the extent of all the type of projects around access to health, behavioral health, capacity building, or COVID-19 response that Potomac Health Foundation would consider this cycle. So for access to health, primary care, maternal and child health, dental and medication, addressing equity issues and access to healthcare highlighted by the pandemic, addressing social and structural determinants of health, such as equity, housing, technical access, food insecurity, and advocacy and policy work that addresses systemic barriers to access to healthcare. The next area is behavioral health or mental health. Potomac Health Foundation seeks projects that support the community through provision of behavioral healthcare services, addressing the implications of COVID-19 on behavioral health issues in the community. Next slide. Capacity building projects will be considered that address individual organization needs, such as, but not limited to, strategic planning, board development, outside consultants, IT technology, but projects that are also not duplicate programs offered by Potomac Health Foundation capacity building partners, i.e. Catch a Fire. And I'll jump into that in the next slide. So currently, Potomac Health Foundation sponsors the Catch a Fire capacity building service for nonprofit organizations and some of our current grantees. So Catch a Fire, for those who aren't familiar with the organization, they provide online support services through skilled volunteers. And so these projects are short-term, anywhere to 1 hour to 50 hours. The projects are flexible, can be completed virtually, and then obviously have outcomes, project steps, and prerequisites as defined up front. And so some of the projects that some of our grantees have worked with them on has been developing brochures, redesigning their websites, updating things related to board education. So again, we're not looking for projects that would be doing something similar that we're already sponsoring. So COVID-19 response and assistance, earlier in the spring, obviously, when the pandemic hit, we did support some of our current grantees and provided some COVID-19 assistance. And we just felt it was important to include this in this year's cycle because we know that 2021 is still going to be a year of rebuilding and readjusting for a lot of organizations. So some of the areas, and again, this includes but not limited to keeping employees and consumers safe, food and essential services, support for healthcare, eviction prevention, and arts and cultural relief. And now I'll turn it over to Kukwa.
So let's get into some pertinent information. So the minimum request for proposal will be $25,000, and the maximum request amount is $250,000. So anything in between those two are acceptable for the LOI. Agencies, especially those with other PHF grants, should consider IRS regulations regarding tipping and the public charity support testing. And if you haven't heard of tipping, tipping is basically having a foundation or grant give money more than a certain percentage of your overall operating budget. Once that foundation or organization gives more than that amount, there can be some issues that come up with the IRS. Some other fine print and other important information is that preference and special considerations for submissions that are evidence-based and culturally humble practices. So if you have a project that shows, certain practices will better the community that you serve, those are welcome. We love applications that use a racial equity lens in provision of services, and we like to highlight the relationship between public health and social determinants of health. I'm going to give it back to Erin.
All right, so jumping into just the process. So the Howard L. Greenhouse Large Grant Program occurs in two steps. And so the first is the letter of intent, which is what we're addressing here on the webinar. And that application is due Tuesday, January 19th at 11:59 p.m. And that is a hard deadline. And then if you are invited after the LOI, then there will be the full proposal, which will be due on Friday, April 16th. So as far as the evaluation criteria, please note that the following are considered when selecting which LOI would move from LOI to full proposal invitation, and ultimately in which are funded. So with that, the Potomac Health Foundation will favor projects that show promise of a significant impact in addressing identified issues, are clearly aligned with the foundation priorities, demonstrate sound financial planning, including sustainability, are thoughtfully planned, and then complement efforts of other organizations and address current and emerging health issues. Yeah, thank you, Kukwa. And then we also consider throughout the due diligence process, the foundation works to identify requests to fund. I already addressed the geographic service area, which is a very big point, and making sure you're addressing how it will impact our catchment area, aligning with the strategic priority areas. And I've seen some people say, at least come up in the chat about, do you pick one? And I think, again, it's how it aligns with the work that you're trying to do. with fitting into one of those areas, be it access to health, mental health, capacity building, or COVID-19 response and assistance. That also addressing the target population, methods and activities, and use of best practices, appropriateness of budget requests, organizational capacity, and then finally, meeting the board approved grant guidelines. Next slide, please. Now, as far as excluded purposes, the foundation excludes the following from funding consideration: programs not directly related to health, public health, overall well-being health, sponsorships, including fundraising events. But a note on sponsorships, please refer to our website on the foundation's latest policies and opportunities around sponsorships. Should you have that type of request or need in the coming months. We also exclude direct support of individuals, programs designed to serve members of religious or sectarian organizations exclusively. The foundation also excludes programs currently served by other sources. So if foundation we would not supplant funding. Retirement of debt, programs that do not or would not have other sources of revenue. I will say, because Potomac Foundation, we cannot be the sole source of funding, but I'll share that we do consider in-kind as a source of funding. Scientific research grants we would not support. Indirect cost percentages is also something that we cannot support. Next slide, please. So what are the next steps? So in respect to the office hours, we currently had, we had 3 dates available, which were Thursday, Friday of this week, and next Monday. However, we currently do not have any open slots, but we are considering opening up an additional slot on Tuesday, January 12th. And then if it's something, just a quick question, feel free to email me if it's something that you think is just kind of a quick yes or no, that's acceptable as well. So we will be providing the recording as well as the slides. And in that email, we will also indicate if there are any additional slots open or if we've opened up that additional day. Go back one, Hoopa, please. Thank you. So the LOI guidelines, please note that while you're in Fondant, which is our grant making system, that each question prompt has a specific character limit. So you see that the total for the LOI is that it will not exceed 1,850 characters. Remember, the limits are characters, not words. And so the sections include, for those of you who haven't had an opportunity to go in yet, agency profile, project information, project narrative, and proposal budget and signatory page. So Fondant, again, for those who haven't gone into the system, new organizations will have to create an account. And once you create an account, you will be able to access the application. If you run into any issues, either setting up your account or seeing the application once you've logged in, please reach out to us and we can help you navigate that process. All right, well, this is the last slide before I will open it up to questions. That all LOIs are due by 11:59 on Tuesday, January 9th. And as I said earlier, this is a hard deadline. Unfortunately, you'll be unable to access Fondant after midnight. Other key dates are the LOI application notification will be March 5th. If you are invited for the full proposal, the How to Apply proposal workshop will be March 17th. The proposal will be due, if invited, April 16th. And then the proposal application notification will be June 4th. Orientation event, if funded, will be June 21st. And the project start date will be July 1st. All right, I will now open it up for questions and just ask that you use the chat feature to post your questions.
So while we wait for more questions, I'll go ahead and go through what we have already.
Okay.
So the first question that I have is from Dr. Vanessa Gaddis, and she asked, can an organization submit 2 separate LOIs if they have programs that fit into different categories?
Yes, organizations can. We recommend not doing more than 2. If you do submit 2 applications, we just ask that you consider, is one stronger than the other, or is it something that you could potentially combine in one? But to answer your question, yes, you can submit 2, but again, we don't recommend more than 2.
The next question is Manassas Park City included in the target areas?
Unfortunately, Manassas Park is not included in the service area. However, even though you're headquartered in Manassas Park, if you decided to do program initiatives in Eastern Prince William County, that would be allowable.
So the next question is from Brittany. Do we need to pick a specific focus, or is it okay if our program/project touches 2 focus areas?
That's a good question. I would say that I can see how this may hit in respect to even COVID-19 versus behavioral health or access to healthcare and behavioral health. I think it's fine. The only thing in Fonda, it will require that you choose one in order to complete the application. But feel free to shoot me an email and we can make note of that when we are doing the review process. If you don't feel as though it may fit in one specifically and you want us to keep that in mind when we're reading the application, that's fine. Or even noting it within the narrative of the application.
The next question I have here is, how do you define project/program?
Okay, so when we do use them interchangeably, project, program, but essentially it's the focus area that you plan to execute through the grant program. And so if it's something related to food insecurity and that's your project or program, and how you build out the program that you plan to use the grant funds for. And so the LOI, you should be able to kind of spell that out. And I know 1,850 characters is not a lot, but at the same time, we want to respect people's time and energy. And this is why we do it in 2 phases. So I hope that answers the question. And if the individual who asked the question wants to unmute and say if I did or didn't, feel free.
All right, so the next question is from Kristen, and I'll answer that question. Yes, the slides will be emailed and the webinar will be posted on our website. We'll be sure to send out the email with the link to the webinar and the slides to everyone that attended. So the next question after that is from Hanford, I believe. For capacity building projects, programs/projects are projects that seek to improve technology infrastructure eligible?
Yes, I mean, if that's something, again, we see it, if it's an internal project that you're planning to do around capacity building, we've had organizations do things like that, or even, they're upgrading their systems in order to, participate in various trainings and or board education. So yes, that would qualify.
Kristen had another question. I believe I can answer this as well. So we received a grant that is ending. Do we reapply as a new grantee or do we wait for the other program you mentioned? So if you do have a grant with us currently, to reapply, you will go through the continuation application funding. And once we get the interim reports, we will decide if your grants will move forward into the continuation application round. So just be on the lookout for an email from us, especially after you've submitted your interim report, and that will give you more of a more information around the continuation application.
And I'll just add on to that, Kukwa, too, that again, for the LOI process, it's a new project. So we're not saying that organizations that we currently fund, that we wouldn't fund a new project, but again, it would have to be something that we're not currently funding your organization for. So for example, if you currently are funded to do work around mental health capacity, but you feel as though now there's a need in respect to food insecurity, well, then that would potentially be a new project. But then if you were thinking, well, we just want to expand the mental health, well, we would see that as falling within the continuation framework.
So another question that we have here is a program that targets food insecurity eligible?
Yes, it is. I actually have it listed with COVID-19 response as one of the potential areas. We've had some organizations also apply under access to healthcare as well.
So we have a question or a statement that needs to be cleared up. It says you cannot apply for programs served by other sources, yet Potomac Foundation cannot be the sole funder. Please explain. Thank you.
Could you read that again? I'm sorry, Kukwa. Could
Sure.
you read that again?
So it says you cannot apply for programs served by other sources, yet Potomac Health Foundation cannot be the sole funder. Please explain. I think where she's from is my tipping bit. So let me re-explain. You definitely can get funding from other sources, and we definitely encourage that because Potomac Health Foundation cannot be the sole funder. What tipping is that we cannot give a certain percentage of your operating budget. So let's say your operating budget is $100. We can't give more than $33 to your organization because that becomes an issue with the IRS. If that's what the confusion is. Let me see. Okay. So I'll wait for the person to reply. But until then, the next question that we have is from S. Stone. If invited to submit a full application, will we receive feedback specific to our LOI areas you will want us to devolve into in more details in the grant application?
Yeah, it's a really good question. After the LOI, when we invite organizations to apply for the full proposal, we also set up time that we can provide feedback. We generally don't provide, well, we do sometimes, I guess we'll say, depending on the project, provide that feedback. But if your organization wants more specific, just kind of information from us and kind of our review of the LOI, we are more than welcome to sit down and have those conversations.
Next question is, does the LOI include all three entities or just one portion?
Entities as far as the project narrative or just access, the focus area, access to healthcare. Feel free to unmute yourself if I'm not as clear about the question. Google, could you please read it again? I'm sorry.
Yes. Does the LOI include all three entities or just one portion? Let me see if Mr.
So when you fill out the LOI, as far as those focus areas that I think you may be addressing, you have an opportunity to choose one of the four. So, even the question about if you were to apply for two, you would then have to go back in and indicate, say one is access to healthcare, and maybe then the second one would be COVID-19 response. I will say though, for organizations who choose to submit more than one LOI, again, we really look for those to be, if you're sending two, for them to be, strong projects, programs to implement. Again, I'm not sure if I answered that question. If not, feel free to unmute, or you can always send me an email or call later.
So the next question is, we work with communities throughout Northern Virginia, including Woodbridge and South Fairfax County. If the project/program would benefit multiple areas, including those within your service area, as well as a region outside of your service area, is that acceptable?
So with that, as far as the funds that we would grant, we specifically want those to be within our service area. There's some organizations that may get funding from other organizations too, and they list that within their budget, saying, okay, there's going to be X amount of dollars from Potomac Health Foundation, which will focus specifically on our service area, but we also have these other funds from another organization where we can expand the program and service areas that we do not support. But the programming we would want to see would be specific, obviously, to our service area. But we understand that if it's expanded, if you include that in reporting as well. But again, we're primarily focused on our catchment area.
So will there be another opportunity to ask questions before submitting the actual application if invited?
For the LOI, yes. I think at this point, I'll just say, we'll open up the office hours additional day on Tuesday, January 12th, since the other 3 days are currently full. Some of those days, which are this Thursday, Friday, and next Monday, a couple slots may open because I think after the webinar, sometimes people realize either that the application criteria doesn't fit their organization and they drop out of those office hours. So when we send out the recording and slides, we'll make sure to also provide a link for Tuesday if you have some additional questions. Those will be 30-minute time frames that we set up that you can ask questions.
So the other question that we have, and I can answer this, can you also send the list of organizations that are on this webinar so we can consider potential partners for our LOI? Yes, we can send out the list of the organizations and the people that signed up so that you have that information for potential partnerships. The next question.
And I'll just add to that, if the organization is not interested in having their information shared, feel free to send us an email and we'll, remove you from the list.
So the next question is, as for the arts and cultural relief, should the project link to mental health and physical health benefits?
They're saying, should it or could it?
Should it? Should the project link to?
Yeah, with the cultural arts, I mean, that could be linked to, as far as health, or, it could be physical health, it could be mental health, but it definitely has to be tied to some component of overall health, public health benefit.
So I'll answer this question as well. Just for clarification, is the continuation application a different application as the LOI? Yes, the continuation application is a different application from the LOI. The continuation application is for organizations that currently have a grant with us that are requesting a new year of funding. The LOI is for new projects and new opportunities. So the other question that we have is adding staff allowed under capacity building?
I mean, I think with a number of the grants in the focus areas or the focus areas, there's a potential where, there could be a personnel, attached to that. So with capacity building, we would consider that as well.
We're almost done, Erin.
No, this is good. I'm glad people are getting a chance to ask questions, particularly, with some of the office hours slots being filled. I'm happy to take the time to answer questions.
So the next question we have is, if we have a grant, if we have a current grant, but the LOI would be for a different program, do we do a continuation application after the interim report is submitted?
Right. So with that, and Kugel kind of touched on this a little bit earlier, the continuation process is a complete separate process. We do review the interim reports, which are due next week. And after that point, we'll make a determination about whether or not we would consider continuation funding. And so as Kugel pointed out, we'll be doing that within the next month or so and reaching out. As far as the LOI, if it is a new project, and again, something separate than what we're currently funding, we definitely, encourage you to apply. But again, it would have to be a new project separate from the work that you've already been doing and partnering with the foundation to focus on. And if you have additional questions about that, again, feel free to shoot me an email or to give me a call.
Okay, so the question about additional opportunities to for questions before submitting the actual application was not in addition to the sessions for the LOI. And so basically what was asking is, will there be another opportunity after the LOI to ask questions before submitting the application if invited?
I see what you're saying. So this is, if you move on to the formal proposal, then will there be opportunities for feedback to touch base? Yes. And I also say, there's 3 of us on staff. We are working remotely, but again, we are available via email and phone, via cell phones. And so my contact information will go out. It's on the LOI. So don't feel as though you can't reach out and that it has to be a specific, time frame. You can always reach out.
Yes. And then the last question, it says, thank you so much for the information. I'm wondering if anyone is aware of any similar financial options for the city of Manassas, Manassas Park, and Western Prince William County.
At this time, I'm not aware of some funding sources or availability on the western part of the county. But I will say that some of our community partners, post information. We unfortunately haven't as much because we've been working remotely, but we've had a calendar and been able to post things. So something that I'll do when we send out the information can just provide some organizations that do some work on that end of the county, or some organizations who kind of focus on just Prince William as a whole and just the Prince William Manassas Park area. Okay, Akuko, I think you said that's the last question.
Yes, it is.
Okay, well, again, I'll pause just for a moment and feel free to unmute yourself if maybe a question you had was not answered. So again, I'll just pause and see if anyone has any questions, additional questions.
Erin?
Yes.
Hi, this is Deborah here over at NCBW. There were a few questions that were addressed under your name.
Say that again, Deborah. There are some questions in respect to
that you and not to the group.
Oh, I see. Hold on. Oh, I see. Okay. Okay, that question was answered. Um, Is there a specific question you had, Deborah, that I didn't? Oh, I see.
Yes.
I see your question. You know what, Deborah, that's something, I have a call with Dr. Howard tomorrow that we can address offline.
Okay.
Okay, wonderful. She's also present right here, so okay,
Oh,
that will
okay.
be fine. Thank you.
You're very welcome. Okay, well, we truly appreciate everyone for joining. I hope, again, we answered your questions. We will be sending out the information no later than tomorrow. And again, have a wonderful rest of the day. Thank you.